a lot of people with OCDs tend to suffer in silence, and they tend to sort of white knuckle it. Obsessive-compulsive disorder is an anxiety-based disorder where the individual experiences either obsessions or compulsions or both. And obsessions are recurrent unwanted thoughts that the person tries to suppress that they don't really want. It can be thoughts about germs or contamination or unwanted thoughts about violence or things that are unpleasant for the individual. And they try to suppress those thoughts through compulsions.
Compulsions, which often accompany obsessions, but don't have to. You can have obsessive-compulsive disorder that is pure obsession. It is usually a behavior that actually doesn't necessarily make great sense in the context of the thought or obsession. It's a behavior that you don't want to keep repeating over and over again, but you really feel like you can't help yourself.
I might feel as though I have to wash my hands many, many times a day because I'm afraid of getting germs and getting sick, to the points where my hands are red or raw or peeling because I wash them to that extent.
People tend to think if you're doing these things that you do have the ability or the volition to stop. And really, when you have OCD, you do not.
Living with OCD for me on a daily basis is trying to get rid of bad thoughts that I have constantly, whether it could be something bad happened to a family member or a close friend, or even to myself. So to get rid of my bad thoughts, different types of touching, physical touching, or blinking my eyes, or phrases that I say over and over in my mind, just to get rid of those bad thoughts.
To diagnose someone with OCD, you take a thorough history and you do a clinical evaluation, and you assess for the symptoms, and you assess for the duration of time and the degree of impairment and suffering.
OCD runs in families. Again, there's clearly some genetic component. There's a biology to it, and there's also definitely an environmental or psychological component, because OCD often presents first after very stressful periods. It gets worse in stressful periods. OCD can be treated with psychotherapy and or with medication. For mild to moderate OCD, most clinicians would recommend psychotherapy. And in the case of OCD, it's really usually exposure and response prevention style of cognitive behavioral.
So you would expose someone to something that they are afraid of or something that they're worried about, and then you would prevent them from doing the action that relieves the anxiety. For instance, if I had a fear of germs, you would expose me to potentially something that has germs on it, and then you would prevent me from washing my hands.
Without treatment for OCD, people can ruin their lives. They can not stop this behavior on their own. They can suffer and destroy relationships and become really housebound. So it's really crucial, and the earlier the better, to seek treatment for OCD.
If you're having thoughts of suicide, get support. Call the Suicide and Crisis Lifeline at 988.